how significant is unresolved trauma and or grief? I'm raising this because 2 of my clients were bereaved, loss of parent, during the first months, years. Well, unresolved trauma and or grief is very significant when you're dealing with OCD. Because remember, the compulsion for them to do the things, the hand washing or the whatever it else that they are compelled to do, is how they deal with the anxiety, the fear, the panic that's going on in other areas of their life. And if they've been left, deserted, if they have a parent die, or if they've suffered some traumatic event, that's where the panic, that's where the anxiety has come from. So that then creates the compulsion that they end up with at the end. And remember what I said on the presentation, for those, especially for those that didn't get a chance to look at it yet. You have to deal with what creates the anxiety and the panic first. Once that's dealt with and there is no anxiety, there is no panic, you're just left with a habit, and it's much easier than to just get rid of the compulsion.
Yeah, totally agree. I mean, the obsessive compulsive is the 2 component parts, is the emotional and the habitual.
Yeah.
And the habitual is easy to interrupt and then put in a new pathway. But if the trigger, the emotional underlying the fuel for the behavior, the coping mechanism. So I think that it kind of maps to that.
It does, yeah.
Yeah, it's like, this is normal, okay, feels okay, but they're feeling like this, they're feeling out of sorts, so they find a way to feel comfortable. Then they practice that until it becomes just habitual and they don't have to think about it anymore. Yeah. So that's why, how significant is unresolved trauma and grief? Yeah, absolutely. Because if it still keeps triggering off, it still keeps the fuel going for the need for the coping mechanism, as Tina has explained. Yeah.